many people do you think are affected by medication errors every single year in the US? Some of you may be thinking 100,000 people. Maybe some of you are thinking 500,000 people. I know a very small group is thinking 1 million people, but sadly, that's closest to the real number. The Food and Drug Administration estimates that 1.3 million people are affected by medication errors in the US every single year. 1.3 million means we need to have a conversation about medication safety. 1.3 million means we need to know our medication better. 1.3 million means we need to own our health. Medications are fantastic. They make us feel better when we're sick, right? But guess what? If an error happens, or if we take it the wrong way, it could lead to hospitalization, disabilities, birth defects, or even death. That means you need to arm yourself with different tools to make sure you're not a victim of medication errors. If you got in a car today to go anywhere, one of the first things you do is put on your seatbelt. If you have a child, you strap them in their car seat, and then you put on your seatbelt. That's because over the years, we've been taught by our teachers, our parents, the cops, how important it is to put on your seatbelt, because in the event of an accident, it can prevent a fatality. Well, medication errors are more dangerous than car accidents. So do you have a seatbelt to protect you from medication errors? Johns Hopkins School of Medicine recently conducted a study. In that study, they found out that 250,000 people lost their lives due to medical errors. That was 100,000 more than car accidents in that year. So again, I ask you, do you have a safety belt to protect you against medication errors? What are medication errors? The Food and Drug Administration defines it as any preventable event that happens while a medication is in a healthcare provider's hands or in a consumer's hands that later on leads to harm to whoever takes that medication. The key part of that definition I want you to listen to is preventable events. That means there's something we can do about it. So I'm here today to equip you guys with those tools to make sure you are not a victim of medication errors. You may be wondering why I'm passionate about this topic. I recently lost my dad to pancreatic cancer. That was a tough time in my life. But one thing I remember about that time is he overlapped on this earth with my son for 1 week. A medication error could have happened, though, that would have prevented that time. He was prescribed a medication for diabetes that would have caused inflammation of the pancreas. So can you imagine if you have pancreatic cancer and you get a medication that's going to inflame your pancreas? That will make you probably pass away earlier than you were supposed to. So because my family and I have conversations about medication safety, my sister Nandit and I were able to catch that error and take the steps to prevent it. So I want to make sure that everybody here and everybody listening to this is able to protect their families as well. In general, we think about responsibility for medication errors being somebody else's. So that's true. The Food and Drug Administration, the FDA, they set guidelines which we follow. Healthcare providers are responsible as well. So, for example, 2 nurses will verify the dose of insulin before giving it to a patient in the hospital. That's their safety belt. In a pharmacy, you have a pharmacist and a technician process different parts of a prescription to make sure an error doesn't happen. So that's their own safety belt. Well, unfortunately, healthcare providers are human and can make mistakes. So that means the consumer, whoever is going to put that medication in their body, needs to take responsibility as well. And your education level does not exclude you from this. You could say, oh, I have a PhD and I know everything I need to know. But guess what? If you're not paying attention with your PhD, you're going to chew on suppositories instead of using them the right way. So make sure you are not forgetting that medications are an important part of your family's life, and you have to equip yourself with the tools to prevent that. I know a lawyer, very busy lawyer, comes into the pharmacy on the phone, very, very important business meeting going on. She was picking up a prescription for her daughter who had an ear infection. So she was so busy, she couldn't get a counsel. And she went home, started the therapy. A few days later, she calls back and she says, that medication is just leaking out. I need some more. My first question was, so when you put the spoon in the baby's mouth, she's not closing her mouth to swallow it? And she says to me, well, she had an ear infection, so I've been putting it in her ears. That was heartbreaking because that poor baby needed to have her ears suctioned out. What safety belt could that mom, this busy lawyer, what could she have done to prevent this error? She could have gotten off her phone for 1 minute and listened to counsel from a pharmacist. She could have read that label, and she would have known that medication goes into the mouth and not the ears, even though her daughter had an ear infection. So I was able to equip her with that safety information there and tell her you have to pay better attention, and you need to make sure you ask questions whenever you're picking up a prescription. Medications are not tic-tacs. If they were, we'll all toss them in our hands and put it in our mouth and just have fun. Or I would feel like Oprah the pharmacist, and you get a pill, and you get a pill, and everybody gets a pill. But that's not the case. You have to pay close attention to your medication. What's on that pill? If you take 4 white pills, what's the difference between them? What are their names? Why are you taking it? For how long are you supposed to be on this therapy? Take the time to do a little research on it. There's a lot of resources out here. The Food and Drug Administration we've talked about, the Institute of Safe Medication Practices, Consumer Med Safety, the CDC. Those are all wonderful resources we can all leverage. Take the time to use them. I know another guy, he calls the pharmacy and says, I've had the most fantastic last 2 months. I took this vitamin from my doctor. It's been so great. It's given me so much energy. I wake up pumped, ready to go. Well, as a pharmacist, that's exciting because you want to hear medication is making everybody's lives better. And I said, you know what? Let me take care of this for you. I'll go ahead and refill your prescription. When I pull up his chart, I noticed the only thing there was an antidepressant. So I asked him, did you and your doctor have a conversation about taking an antidepressant? And he says no. So I asked for some time to talk to the doctor's office and figure out what was going on. We talked about human error earlier. It turned out that when the doctor was transitioning from one patient to another, he forgot to log out. And so my patient ended up with someone else's medication. So in this case, he was lucky. He got happy, right? He had a great time. But imagine, it could have been something that would have destroyed his organs, maybe caused him to have a birth defect. I want to make sure that we are all aware of the fact that there's something he could have done to prevent that error. He could have done a little research when he went home. Use the resources I talked about, Food and Drug Administration, Consumer Med Safety, and Institute of Safe Medication Practices. He would have found out really quickly that what he was taking was not a vitamin, and it was an antidepressant. And that would have been his safety belt. So that is a step we all need to take every time we pick up a prescription. If you don't remember anything I've talked about so far, I would love for you to remember 3 things, though. The first thing, you need to ask direct questions, and you need to listen to counsel. So if you go to a pharmacy to pick up your medication, I want you to say, I am here to pick up my blood pressure medication. That's going to cause the pharmacist to stop, look at that bottle, and make sure what you're getting is a blood pressure medication. That's your safety belt. The second thing is you need to know your medication. What are you putting in your body? How is it affecting your organs? Make a list. Give a copy to your doctor. Give a copy to a family member. So in case of an emergency, you would be able to rest assured that somebody knows what you're taking and will make sure you get nothing that will interact with that. So include your over-the-counter medication as well. The third thing I would like for you to remember is you need to do your own little research. Before you put anything in your body or give it to your family member, make sure you're 100% aware of what you're taking. You see, healthcare providers are experts in their fields, but they can never be an expert on your body. That's you. You are the expert in your body. So you need to know your medication. You need to own your health. You need to put on your medication safety belt, which is the 3 things we just talked about. Own your health, know your medication, and be safe. Thank you.